Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to go talk about this case right here. This is a really excellent result for this patient. We got this over several years, really, for this particular patient, over about 2.5 years. It took multiple steps, really, to get this. But it's a really wonderful result. So as more people join us, I'm going to go through and walk you through this particular case and kind of remind people just about this journey, this process. Even for very severe scars, there's ways that we can improve things if we're really patient. So I'm going to kind of talk about how we got this, which is really cool. You know, this is a patient who had severe, deep scars, and she really found that it was really making it seem as if she was aged. She found that really that it was affecting her confidence, her self-esteem, and was willing to do whatever it would take really to get the best possible result. So we talked a lot about different things, different options, and she opted really more for lasers and really for the subcision and volume replacement process. And we were able to get that here for this patient. We did a really wonderful job in getting her. And one of the ways we did it really was by constantly actually breaking. We did something where we broke up that scar tissue, and then eventually what we ended up doing was placing some volume in there. We, of course, had to do lasers to resurface, but it was a process that really ended up, it's, as Mrs. Jones, good seeing you on, Mrs. Jones. Mrs. Jones saying it was life-changing. This is life-changing, really. So it's awesome because over time, we could continue to get better and better results like this. Really wonderful. Like when she came in for this photo, I ended up placing a little bit more Bellafill, so it's going to get even better results. So it's a whole journey. Hold on, let me put my dog here. Oh, it was just her birthday a little while ago too, by the way, actually. Sit down. Let's see here. Rowley's saying a clinic in Canada doesn't offer subcision. I have scars similar to that person on the screen. What do I do? Well, I have a lot of patients from Canada. You know, that's what I'll tell you. I have a lot of patients from Canada. And I'll be happy to see you when you're ready. Thank you, Mrs. Jones. Yeah, she's a toy golden doodle. Thank you. What kind of anesthesia do you give for erbium laser only in your office? Usually I do nerve blocks, really, especially if it's done for scars. But if it's like you're talking about like a lighter peel, like a lighter laser, then I probably would end up doing more with the just topical numbing then. If it depends, you know, if we were like doing scars, then I usually don't do topical numbing. I was talking about that yesterday because it does some micro swelling there and we may miss some of the scars. But with when I'm doing things like just for like anti-aging purposes, then yeah, we definitely could do topical numbing. Thank you, keep it zen. Appreciate you coming on. Val Kimmy's here. Good seeing you today, by the way. Thank you so much for coming on. Saida saying, what would you recommend for max dosage for glutathione? I don't actually do glutathione. You know, it's something I'm not really comfortable doing because of just the liver toxicity issues that you could occur with it. So not something I particularly use. It's like fine for small bursts of it, but I'm not like in favor of doing things that could actually lighten your skin like more than your natural skin tone. I try to get just to your regular natural skin tone. I'm trying to get people to get lighter than that. So I'm not really a person to use glutathione, although there's a lot of people that do a lot of it. And that's probably something that we'd have to probably defer to someone like that. I do get concerned with anything that's like elective and cosmetic procedures that could cause something like liver toxicity. You know, like that's a big concern. Like I wouldn't want anybody to have liver failure. That would be really terrible. So, you know, you have one liver. You have two kidneys, but one liver, you know, so it's like, kidney failure is a mess by itself, but liver failure is just like, that's it. It's done. You have to get a transplant. So it's like, that's the last thing I want to cause. So that's why I take it very seriously. Good. About Kimmy saying she just did a procedure today, her second step. She's looking awesome. Her scars look great. She's saying, hi, I'm healing great. I'm not swollen at all. So about Kimmy's scars, she had mostly vascular scars and a little bit of some icepick scars, but mostly vascular scars. And initially it was more like some rolling scars too. Did subcision, worked out really well for that. Did excision too. And now I saw her, we did a little bit of Bellafill, and the Bellafill made it seem like the scars were close to invisible, which really showcases to us that some volume replacement is going to be really important for her over time. And actually, it's going to get pretty close, you know, to that polished look that she's trying to go for. So I'll show her result at some point, but really awesome, you know, really awesome. Let's see. Is this micro swelling that gives a lifted illusion? This is 2.5 years out, so there's no micro swelling here at this point. Not that, I mean, it's a fair question. I know there's a lot of people that showcase things with like a week out. I'm never showcasing anything a week out or anything like that. You know, this is 2.5 years of a journey of a very complex case, very, very complex. And a lot of work was done. So yeah, there's no micro swelling here. This is it. This is it. This is really, she got there. She's not, you know, she still like wants to do a little bit more here and there when she could have like with her budget, you know, allows. We'll keep doing a little bit of volume replacement, things like that. So we'll polish off a bit more with the lasers, and that's going to help her out as well. Just a lot, you can see some thickness still of the scar tissue. That's why I always show this process. You know, it's not like it's ever like really, it's not like a perfect 100% result there, but it's pretty close. You know, it's pretty close right there. And you know, we're there 2.5 years later. Like that's why I tell people it's like sometimes it takes 2.5 years of like, and she's somebody that lives pretty local to me, you know, so she was able to do a few steps really and do a lot more with volume replacement, which she needed. Did you do a lot of volume replacement for her? Yes, I did dilute Radiesse initially because in her case, I wanted to help with just the elastin production. There was a lot of laxity there. I wanted something that's going to improve just the feeling, the tautness of the skin. I did more with collagen stimulation too. I did some Bellafill. And yeah, just I kept on putting a little bits of that. This whole area, this whole process here, it takes a lot of work to slowly rebuild that. It's not something you can just shove a bunch of product in there and then hope that it's going to look great. It actually could look terrible if you do it that way. You just do a little bit, you let it integrate with your tissue, then you do it again. Then you do a little bit and you wait again. And these are biostimulatory products, so it's like over time they get better and better. Can you explain what volume replacement is? Is that like injections? So this is injections. Yes, these are either with, you could do injections of products like hyaluronic acid, which I typically don't use for scars, or you could do it with biostimulatory products like Bellafill, Radiesse, Sculptra. All could be options there for us. Those are what I usually do for volume replacement in the lower part of the face. Other parts of the face, though, we could do more like fat transfer. That would help out for patients. And you know, there's people that do other forms of volume replacement, which I wouldn't recommend. Things like silicone injections, really not a good option. It could cause inflammatory responses, nodules really quickly, really easily. Almost, there's so many patients that I've had who've had that, and it's like a permanent product that's sitting there that's called these inflammations, and basically cause it so that there's the swelling in the skin. So I wouldn't really recommend that at all. I'm looking at into this with Sculptra. So yeah, Sculptra is an awesome product. I use a lot of it. Lower part of the face still, usually areas where it's more mobile. I really do prefer more things like along the lines like Radiesse works well and Bellafill works really well. So I usually use those options there. Restylane, yeah, Restylane is one of those hyaluronic acid products I was referring to, which I usually don't do for scars. And this particular patient, people are asking how old she is. She's in her 30s for this patient. So she's in her 30s, suffered a lot from scars, suffered a lot from it. And it was a long journey to get to this, but we ultimately got it. It's awesome. You know, it's an awesome result, awesome progress. So I'm really happy that we got it there. Let's see here. Did you use CO2 or erbium on those indented scars? I used ablative CO2 laser for like the thicker parts of the scars, and like it was really fully ablative. And then I used a fractioner form of CO2 laser to get a little bit of skin tightening there. I used erbium laser as well. So I did a few things like that. And appreciate you, Dr. Karobi. Appreciate you so much. Thank you. Can I microneedle with a pen at home with the proper training and knowledge? Pen microneedling devices are not great in general, and with scars, they could really make the scars worse. Not something I would recommend really at all. So if you want stamping devices, you could maybe consider that, but I wouldn't recommend microneedling devices like pens. You'll hear story after story of patients who've tried it, and it made their scars worse, especially like boxcar scars can get worse with that. Ice pick scars can get worse with that. It could get wider with those, so I wouldn't recommend that. How well did her collagen respond to the filler? Incredibly well. Really, it was really excellent. It just was slow. Again, like about 2.5 years worth of a journey really for her. So it's a slow process sometimes. It's just, that's how you have to do it to be able to get a result that's going to last for a long time. These patients are people that, really suffered a lot. and they want to go back to what they should have looked like, or potentially what they even looked like before they had scarring. Actually, Bao Kimmy's on here. She was saying that she didn't have any scars or acne until she was 21 years old, and it just like flared up so terribly and caused some scarring for her. So she knows fully what her skin was supposed to look like, what her face was supposed to look like before that moment. And you'll hear over and over, a lot of people would say that. There's people that, their skin was totally fine until they were in their 40s, and, especially women, they were in their 40s and suddenly they ended up getting a severe cystic breakout, and then it caused acne. And it was actually a lot worse for them because at that age, it was difficult to really be able to, control and like the workplace. And it was just like, there was a lot more stress, a lot more social anxiety now, because it's just like an unexpected age, you start having these flare-ups, and it's something you never dealt with before. It's really terrible for some people, because it's like your whole life is going okay, and then suddenly you just have this like terrible flare-up, this terrible cystic acne. My patient last week was informing me that she had it during her pregnancy, and nobody put her on any medications. Nobody did anything for her. So it's it's a sad story here over and over and over again. And it's tough because you had a moment where everything was fine, everything was okay in your life, and then suddenly it's like you have a terrible cystic breakout, and it's just like it's tough to control, tough to manage. And you'll hear people, like, a lot of times, there's so many different things. The common themes that I hear. One is that people a lot of times will blame themselves because they think that they use wrong products, or they think that they pick too much, think that something that they did triggered this and caused them to suffer this way. And it's like sad, because a lot of this is actually really due to a robust immune response to your cystic lesions. Basically, when you have acne, your body just goes really haywire sometimes in some people who are predisposed to it, and they destroy the skin, and also sometimes destroy fat. One of my patients, he gets these cysts, like actual cysts, like these cysts form, and he says, it's just my fault. I just keep on getting it. So it's like, it's not your fault. It's not your fault. It's just like it's happening. You just keep your skin clean, all these things, and it's like we have to come up with other ideas of how to control that, so that you don't get these cysts, and then it doesn't cause scarring. But it's like people blame themselves a lot over and over and over again for their acne, and then when they're looking at themselves with their scars, they're blaming themselves for the scars. They're blaming themselves for the scars. They're blaming the fact that this was something that happened when they were younger, and they should have taking care of this a different way, or their parents should have taken care of it a different way. And it's really difficult to kind of, for people to wrap their minds around the fact that, like, there's so much of this that's so out of their control. And even if there were things that potentially you did do, it's like, think about what the reason why you potentially did try to pick your skin. It's likely that you're like anxious, it's likely that was your coping mechanism for the fact that you had acne. It's likely that you didn't have direct access to somebody who could take care of the acne in an appropriate manner, and you just didn't trust the person that was taking care of it, or whatever other reason was occurring there. But a lot of times it's because you wanted some sort of control over what was happening to your face. And it's possible that you were like 14, 15, 16 years old when this occurred. So it's like, who could really blame that mindset when you actually think about it? And there's a lot of other people who do pick their skin. I'm not saying to pick your skin. I'm just saying there's a lot of people who do pick their skin and they don't get that severe scarring. So it's, something you just have to forgive yourself for. It's something you just have to like really look at and think to yourself that like that happened when it was like you were younger. But it's been like, for this last several days, I hear, and it's really sad. It's really, really sad how people have suffered so much from just the process of acne. And then they blame themselves right now today for the scars. Or they blame the fact that, they went to dermatologists who did things that were not the best treatments. One of my patients today, he did 3 subcision sessions with a physician, a dermatologist in LA area, who does this over and over again, where I have done repeatedly revisions on his cases where there's so much scar tissue still in there. And it's remarkable. Like I have to just start recognizing, because I assume that somebody does 3 subcision sessions, at some point this guy's going to get these scars. He never gets it right. Anytime I do revisions on him, he's always had so much scar tissue still in there. And it's like, it's not the patient's fault even a little bit. That's just a skill level issue with the person he went to. But it's not his fault that he went to that person. It's just that person's fault. Really, it's that person. It's that dermatologist's fault. It's whoever did that thing his fault. And it's like, they should have done a better job. They should have done this at a better level. They should have made sure that they could do this at an elite level. Otherwise, they shouldn't be touching people's skin. They should not do it. There's a lot of stuff that they shouldn't do. It's just there's a lot of things. And we could do this at an extremely high level, extremely safely, over and over and over and over and over again, multiple times a day. Do this for years, over and over and over again. And it's like, we don't run into that kind of issue. So the fact that you or people out there that are doing this stuff and they're claiming that they're doing the subcision and they require 3, 4, 6, 7 subcision sessions, and they're inflicting this trauma again on patients over and over again, really showcases to me that these people really shouldn't be doing this. And, one of the people that's on here right now, she was telling me that she spent $5,000 on skincare products, $5,000 on skincare products from a dermatologist, not the same dermatologist, but different dermatologist, and $5,000 on skincare products, just on skincare products that for their scars. And it was like severe, some of the areas were deep scars. What was a skincare product going to do that's going to help with that kind of scarring? It's really unfortunate. But it's not her fault that did happen. It's not her fault that she ended up buying the skincare products. It's not her fault at all. What it is that dermatologist's fault. It's his fault that he did that. It's his fault that he sold someone $5,000 worth of skincare products in order to try to work on the scars. And you know what we worked on for this patient's scars? What the skincare products were? We used a pigmentation cream, that's true. But other than that, what we did was we used moisturizer like Vanity cream and a physical sunblock, and that's it. Just moisturizer, sunblock. That's what I did. Initially, for like first few days, I do some supportive care for burns because I do a lot with burns and I know how to manage burns. And that's how I can manage this really safely and effectively. And we get patients that come over all over the world who are Fitzpatrick 4 and above because we could do this safely over and over and over again. So I know that like people say, well, there's people that get affected by lasers. There's people that get affected by this, affected by that. And that's true. I wouldn't do this stuff with them either. I wouldn't do it with either. And I'm in this industry and like I see their hands, I see their work, and I just wouldn't go anywhere near some of these guys. Really, even if I was like a lay person and things like that. And when I was in that side of things, when I was going through the side and like going through and talking to these guys, it's like there's a lot of stuff that I just want to trust with these guys now. And I want everybody to see that. You'll see that like over time, a lot of this stuff is going to change. A lot of things are going to change with this whole thing. Let's see here. Is it safe to do these laser treatments in the summer or best to wait until winter? Actually, summer is one of our busiest times, actually. It's so busy. And it's awesome. I love it. I love the fact that it's like we have people that know what they want. We're in California, so it's basically, it doesn't matter. And we use these visors, actually. You can use visors to protect yourself. And you just, of course, there's a lot of sunblock. You can also use something called HelioCare, which is basically internal. It'll actually help us basically do what it does is an antioxidant for sun exposure and helps prevent pigmentation too. So there's a few different tricks that we could do, but we could do that really constantly. And John, I'm actually just going to skip over your question, whatever the question is. You're just being really rude. So whatever it is, I don't care. So we're just going to skip over you. Akay is saying, what are your thoughts on injector miso guns? Does it reduce the risk of VO? No, almost anything that's hyaluronic acid, pressure, it actually could be too much pressure going in there, and that could end up causing an occlusion. So almost anything could do that. There. Are you located in New York? No, we're just in Newport Beach, California. We're literally just 5 minutes away from the airport over here. So that's really easy for a lot of people that just fly in and fly out. That's all they do. Can lasers help with the scarring from... Can lasers help with the scarring from HS areas? Yes, it could, but a lot of times what we have to do is more with like Bellafill, for example. That could work incredibly well. Actually, it works really well for HS particularly because a lot of times there's a lot of volume loss, a lot of fat destruction with that. So I do like doing it that way, actually. What are post-session treatments to follow at home? Well, it's mostly just going to be moisturizing sunblock, Dr. Karobi. Mostly that. We're not going to have to do too much more in terms of procedure stuff that I expect people to do at home. I'm almost open to like other things, but I actually don't use like red light therapy, things like that, because I am worried more about pigmentation issues that could occur with it. So I keep it really simple afterwards. I understand that like there's like benefits to that, but like my acne scar patients, a lot of them are darker skin types, so we got to be very careful. And then the other thing is that I also want to be very careful is that I don't want things that are going to cause acne. These patients are more complex. Your skin a lot of times is more sensitive. So we got to be very careful. I want to make sure that we're not going to do things that are going to trigger acne too. So I keep the skincare products just very narrow for what we're going to do. That's what I do. I keep it very, very narrow there. So that's all I do. Let's see here. Shaman's is saying, why are there so many cases now of filler staying on for years and migrating? What causes this? Good question, actually. There's a lot of cases of filler, usually hyaluronic acid filler, where it shifts because it draws in water. So the reason why there's so many cases now is because it could last for years and years. And they basically were telling people that it's just going to last only 6 months. It's only going to last a year. But when it was placed superficially, it was lasting for a long, long time, 8 years, 12 years, things like that. And sometimes in the under eye area, it lasts a long time. And over, like several years ago, like for a few years really, people were really pushing a lot of hyaluronic acid filler in the mid cheek even. They were pushing a lot of people telling everybody. There's like this epidemic everywhere where people are saying just shove a bunch of hyaluronic acid filler in the mid cheek. Oh, that's what you need to do. And they'll have these trainers go by and say this. And what they'll tell people, they tell me all the time. They're like, listen, this is what you have to do. You have to do this many vials and you have to do this. And you have to do 6 vials. If it's not 6 vials, it's not going to be effective. It's blah, blah, blah. And it's like they're just trying to like shove all this product on everybody. And unfortunately, a lot of people got like pushed on this product, and it wasn't great for them. They put it too superficial. They used like cannulas that were not appropriate for that area. So I wouldn't recommend it, for the way people inject it. You have to see like who you're going to, see the person you're going to. You're probably going to end up looking like they're aesthetic. If you look at them and they're looking at and they look really unnatural, chances are that's their aesthetic. That's the look that they're going for. So be careful with that because you may end up looking like that. What about Volbella for the lips? In general, I don't do anything with Vicross technology, and Volbella has Vicross technology. There's chance of an immune response. It's very, very difficult to dissolve, extremely difficult to dissolve, and it could shift. It could cause more reactions there. I've had nightmare cases where patients had gotten Volbella really underneath the eye area, and it ended up basically just like taking a lot of work actually to just remove that, a lot of work, and to dissolve that. You use ultrasound, and it's still like little bits of it could still come back. It takes a lot to actually remove it sometimes. So I don't love it really. So I don't use Vicross technology in general, especially in superficial plane. But like Restylane works really well there. Lady E saying I lost a lot of weight. Well, I'm actually about the same weight that I just like fluctuate like 5 pounds sometimes, and that's like really visible. So that's what ends up happening. I run around a lot and I work out a lot too. So that ends up happening. But thank you though for keep an eye on me. You can keep an eye on me and watch. Kofi Grams is saying, what sunscreen do you recommend? I know I need to use it, but I hate the way it makes my skin look and feel. Super shiny, and that makes my scars look worse. I'll post a couple options that I found. I like Mesoaesthetic, especially for like patients with hyperpigmentation, works really well. Mesoaesthetic, the one that's like the tinted one with, it's basically got iron oxide in it, which works very, very well. But there's other options. There's one that I've been using. It's like this Korean one that I was using. I actually find a name. My wife had a name actually. I don't know if she has it on her anymore. But it was actually really cool. Actually, I'll tell you that one. Actually, I've been using that one, and it doesn't seem to make my skin more oily or anything like that. So I'll take a look and see. How many of those treatments to see good results? So it depends on what you're trying to achieve. I mean, this patient really wanted to get as close to a polished look as possible. Took several steps. We did about three rounds of fully ablated CO2 laser there. We did subcision there one time. We did a lot more with volume replacement. Yeah, it could be my haircut, lady. It could be my haircut, I think. Maybe that took a few pounds off me. Is Banish Micro Stamp good? Banish is okay. I mean, it's okay for like mild scarring. Not going to help much for these kind of scars. But people are saying, well, you could do a micro needling pen. I would not recommend that, but something like stamping, that's better. So I would do that. How long does it take to heal from TCA Cross? It's actually just a matter of a day or two. It's really mild. Yushka is saying, hi, Dr. Qazi. I did my 5th TCA Cross 3 weeks ago. My icepick scars changed slowly and steadily, but my deep boxcar scars look more or less the same. How long does it usually take to lift deep boxcar scars? It sounds like you're not my patient. I'm not sure if you are or not, because I normally would do a little bit of volume replacement there. And that's what I did actually. Bao Kimi is on here right now, and she has like deep boxcar scars, and I ended up doing really well with that with some Bellafill, and it solved it almost completely with those. So sometimes deep boxcar scars, there's a way to go directly in the scar, place a little bit of Bellafill, and slowly keep working on it, keep chipping away at that way. So, and you also can do, of course, laser on the side and potentially a little bit of TCA. Let's see here. Nafisa is saying, can just doing TCA Cross work for deep ice pick scars? It's questionable. It's questionable. I mean, it could take several sessions. Of course, you could ultimately get there, but it's so deep sometimes, and it could take so long. Usually, as it gets more superficial, I do recommend doing a laser. It's just a faster process, a faster way of getting it there. Vinod is saying, hello, Dr. Qazi. Does fat grafting deliver better results compared to Bellafill? Vinod, if I remember correctly, with you, didn't you get fat grafting already? Like, if I can remember correctly, if that's the case, I think that I was saying that there's just certain discrete areas that I would use the Bellafill for. You did fat grafting elsewhere, back in India, and you came over, and we were talking about just like some of those spots. I don't think there was that much volume loss left, and so I was saying just a few areas that would do Bellafill. Good to see you, by the way, Vinod. Lady E saying, do you only work with acne scars, or can you help with dark scars on my legs? I work with all scars, really, with anything like that. It's basically skin restoration, and my partner does it as well. So it's like we could definitely work with anything that's there for pigmentation, for wide scars, if it needs a lot of revision type of things, all that we could do. Taylor Gray is saying, can you explain Bellafill? Yeah, of course. Bellafill is basically really awesome. I love it. Because what it is it's made out of 80% cow collagen and 20% something called PMMA. That 80% cow collagen goes down over the course of about a month. And then what ends up happening is that PMMA stays there, and your body makes some new collagen around it. And it works really well for that. Works incredibly well for that. Just got to place it in the right spots. It has to be really just like done slowly, little micro droplets, and then you wait a little bit, let your body integrate with it, and do a little bit more. Any tips for helping fresh stretch marks not be so bad? Well, you could do silicone tape, actually. That's usually one of the best options to do there. That's actually a really good way of doing things, but especially if it's a fresh thing. Let's see here. How good is niacinamide? I have PIE and minor scars. That's good for it, but probably better option is probably going to be like azelaic acid. That's probably going to be there. Let's see here. Doctor, I've been taking moringa, and it has really helped with me with acne. I recommend it to people. Yes, that's perfect. That's awesome. That's something you could consider really. I'm glad that you're trying to help out people. It's important also, just everybody should just try to get, without like judgment, without like telling people that this is what you needed to do and like, why did you not do it? But like just telling people that, hey, this is something that like I used that helps out. Sure, try it. I tried a lot of those things. I tried a lot of those herbal supplements. I tried one of the most nastiest things ever. I forgot the name. I actually asked my mom. I tried it for like several months. It was like the nastiest thing that I ever tasted. And I did it for so long, and it never worked, and like everyone was saying that was going to work out. It didn't work out at all. And so some of the stuff was like so nasty, and like sometimes I don't want things to like delay like your response to doing other treatments. So if you're doing these herbal supplements, maybe like it's okay, but it's questionable, honestly. There's a lot of other things that just like we know will work, and if you want to do like an herbal supplement on top of it, maybe consider that. But I just don't want to delay anything that could cause this kind of scarring. The last thing we want is this kind of scarring, and we want to avoid that. Whatever it does, whatever it takes to avoid it. Avak is saying, hi, Dr. Qazi. You treated a spot near my mouth 2 weeks ago. Thank you so much. I forgot to ask if the Erbium would temporarily slow down beard growth in the area. Oh, hey, Avak. Good seeing you. It's going to be a little bit irritated there, but not really quite going to actually slow down beard growth quite well. But you shaved it over there, so that's probably what you noticed there, because we had to take a look in that area. Marcel is saying, how many rounds of subcision are needed to see significant improvement on moderate scarring? Well, this was with a single round over here. Most patients, vast majority of people are single round with me. Vast majority. I mean, literally, it's like less than 10 people that I would say that I do more than a single session. It's like if you're doing it's like that lower part of the face that I was talking about that's really complex. Like this patient was very complex, but we were able to do it in that single session. Everybody that this whole week was very complex case. I've been saying it every week, but like today's case, this is the guy that poor gentleman that went to and did 3 subcisions, and with this doctor who continuously does it this way, where there's so much scar tissue still in there. And it's like, I did it, and he knows it was completely smooth at the end of it. He's like, that never happened to me ever, any time. Never did it that way. You know, the doctor was just doing each individual scar. He's using that technique, and he was missing a lot of stuff, doing you know, who knows what was going on there. And there's so much scar tissue still there, so much scar tissue. And it's like, we now know that like it was just done properly. Even if it means I have to take a lot longer, whatever I have to do to get this done, I'm not going to be done. I'm not finishing until I'm done with it. I'm not putting you guys through it again and again. It's just silly. Unless we just like, you know, it's not safe or something like that. But if we could get this done in that session, I'm going to do it. And everybody knows I'm going to do it. Like, there's no question. Like, everybody that's been on the table with me doing the subcision knows that I'm breaking up that scar tissue. And it's like, we're doing it. And it's going to be like very, very effective there. Do people ever have bad reactions to Bellafill? Do you ever need to do a skin test? We could absolutely do a skin test. That's totally fine. If you're concerned with it, you absolutely can. It's more like if you have certain autoimmune conditions, though. You know, there's definitely like a component where if you have conditions like sarcoidosis, for example, or Sjogren's syndrome, those particular ones, I would say that you would want to consider doing the skin test. And also, like if you have an allergy to bovine or cow, then you could consider that as well. But yes, of course, if you have any questions with it, you absolutely should do it. So do a skin test and see if it makes sense to you. But I don't, when I own patients, I've never run into that problem. Have you ever had lumps of Bellafill? Actually, I've not myself, but I deal with patients who've gotten lumps elsewhere. And the way I deal with it is actually just doing it with 5-FU combined with Kenalog a lot of times. Look at it with the ultrasound, and you could actually just smooth it down, smooth out a lot of that collagen buildup really not well that way. So never really been a problem for me actually with that. So, and actually that's worked out very, very well. What's the most popular intense procedure you've ever personally done? Well, I've done Subcision. I've gotten Subcision done, which I guess is the most intense type of thing. I've done ablative CO2 laser, which again, intense type of intense procedure. So that worked out really well. So those are probably, I guess, the more intense type of things that I've done. Is this result with or without the use of filler? This was actually the process over the course of 2.5 years. We did do collagen products like Bellafill as well as Radiesse. We did Subcision. We did a fully ablative CO2 laser as well. Took a lot of work, a lot of steps really to get to this. Really took a lot of things to do. We got there though. And it's life-changing. This is one of those things, a lot of people are saying it right now on here. They're saying it's like, it looks life-changing because it's like, that is a life-changing result. Just imagine suffering from these kind of scars for your whole life and like just believing that for a long time, like a lot of people do, that they did a lot of treatments and there's nothing that's going to work. They find that it's hopeless. And, you know, and here you have it. You have it where like we're pretty close, and it gets to a point where it's like then you start pointing at just 1 or 2 scars now, and it's like a pretty cool thing actually, right? That's a pretty cool feeling. Like at one point it was so deep, and now you're just looking at it like it's pretty mild here, and it's like, you know, a lot of people would be very, very happy with just that level right there, and it's like, you know. You put yourself through it. You went through it. You could do anything now. You go through all this. You could do anything in life. I could tell you that. You know, you put yourself through this journey. And it's like anything else now, like don't listen to anybody who says you can't do things, because you definitely can do it. And you absolutely, like you're doing it. Like you put your mind through it and you're capable of doing things, because this is like, it takes a lot of mental fortitude to get through this. And like just even having the acne in the first place, having the scars, all that takes a lot. And it's actually like a really interesting process that occurs for a lot of people. You know, it's like where they have these kind of scars and they do feel like really, you know, they're more attuned to people's emotions. They're more empathetic towards people. And, you know, they're more aware when people are potentially like bullying other people, for example. All good things, really. You know, it's all really, really good. So in a way, like, you know, the people that kind of follow this stuff and learn, and like you guys in the chat and the community, like you guys are all kind of part of that, where you see that like there's a lot of suffering out there. You guys are aware of the suffering that occurs with acne and scars and or pigmentation, or aware of the people that do suffer from that. And you're aware that like it's just not right if somebody is picking on someone for that stuff. You're aware of it. You understand it. You may see that there's someone suffering from acne or so and things like that, and how people may feel with that. And it's actually, think about how that's actually a really, really valuable skill set, because you're going to be able to recognize the people who really punch down, the people who pick on people who aren't really as fortunate to have clear skin, who aren't as fortunate really as some of these other people that are walking around with super smooth skin and that look around and don't appreciate what they have. You could appreciate it. You could be grateful for it. And like that gratitude actually really can give you like a lot of happiness over time. And like now it's like we've altered this patient's, timeline. We're having a point where, she could have been going down a route where it caused a little bit more anxiety for her. It caused a little bit more depression. And now it's like this is removed for her. This thing that was holding her back, it's been removed for her. And maybe there's a little bit that she still wants to improve or so, but it's not what it was before. It's not like the suffering she had before. She doesn't feel like people are looking at it the way they were looking at it before. And people will say, well, it wasn't that bad. It wasn't that bad. But the fact that they're saying it wasn't that bad showcases that they did notice it, and it was bad for that person. Even though it wasn't maybe not even severe as this case, it's like, it was something. It was something that was making you suffer. And it was like this extra background noise. It's something else that like caused you not to achieve the best possible version of yourself. Something else was out there. And that's the thing that we have to solve. And that's what we're doing. We're doing things that are shifting people's lifestyle, like the way that they're going in one path. And, it was like potentially not at their true level. There were a lot of people, actually this whole week was actually a very interesting week. I had a lot of people that were doing their second, third sessions for me. And it was like difference. It was a total difference. One of the patients she's on right now, actually, even though she just did a procedure, she comes on here sometime, breast and tail. She was saying, like it just was life changing. Just 6 months ago, I worked on her. She drove all the way from Houston, Texas, with her husband last time. And it's like, it's amazing. Here we have a process where like this is like shifting. Things are like shifting for her journey in life. And it's like, that's a pretty cool thing to have, that somebody now was going one direction and potentially not achieving the best possible version of themselves. And now they have the capability of doing it because this is no longer something that's holding them back. Now they could feel like they could go out a little bit more. They could have more friends. They could do things. They're not going to say no when people talk to them and want them to go out and hang out, and they'll be able to do it. They'll feel more comfortable doing it. That's a pretty good thing. They're not as lonely anymore. That's like, I'll say over and over, one of the big goals of what we're trying to achieve is to prevent loneliness. We want people to no longer feel that loneliness and the isolation that occurs when you have acne and when you have scars or you have pigmentation, or even if you have facial imbalance, whatever else it is. It's like we want to solve that. We want to solve that. And one of the things to solve that is this. Because loneliness, remember I told you, Hannah Arendt's Origins of Totalitarianism, loneliness could lead to totalitarianism. It's pretty interesting. So it's like we want to work on people with that. We want to help people with that. And so that's what we did. That's how we try to work on it. And thank you so much, Sailor Moon. I appreciate you coming on too. I've done a ton this whole week, so I am going to take off for tonight. But if you guys are interested in learning more, first of all, follow me. Hopefully you guys are following. And then also, we'll be on again between Monday and Thursday of next week, and just schedule a consultation. You could do a virtual consultation. If you're happy with these type of things, want to go through this journey, you're ready to do this, I'll be happy to help you with it. And just schedule. You go through my page, drqazi.com, and we'll be happy to help you guys. I appreciate everybody so much. Yes, it is an amazing improvement. Thank you so much, Simi. I appreciate you guys.